Mr. Speaker, I wish to thank the Holy Spirit for once again giving me the strength to represent the people of V4 North. And I want to thank all those who have been at my side before me and behind me to ensure that I do the best that I can in the constituency and with my responsibilities as Minister for Health, Wellness and Elderly Affairs. Speaker, I stand here today, I raise my hand and I roll up my sleeves. I join my Prime Minister and colleagues in this ambitious project of redirecting a nation where opportunity for all our people is our only priority, where we will empower our people and transform our economy. Mr. Speaker, I repeat our manifesto promise in putting you first on page 20, and I quote, "A St. Lucia Labour Party government will pursue a health policy that is patient-centered, evidence-based, equitable, accessible, and affordable." We also promise, Mr. Speaker, to engage the retired and the elderly. There are 11 areas of focus in the manifesto, and for us to achieve these goals, there must be deep reflection and action to reinvigorate the centers of responsibility for which we have oversight. All around St. Lucia, Mr. Speaker, there are people who call daily with ideas, with suggestions, and who want to commit resources to the reorganization of our healthcare system. What we have can be improved, Mr. Speaker. We can do better. We deserve to give ourselves better. Our efforts will be focused, and my commitment is unwavering, Mr. Speaker. In this regard, I wish to thank the Permanent Secretary Acting, Ms. Jenny Daniel, Ms. Rhys Inglis, the Deputy Permanent Secretary, the CMO, Dr. Belma George, and all of the staff of the Ministry of Health, Wellness and Elderly Affairs. I wish to thank the chairpersons of our various boards, Mr. Michel, the Millennium Heights Medical Complex, Mr. Elevic of the St. Jude Hospital, and the various board members, Mr. Speaker. I wish to thank very early on all the various councils, the doctors, nurses, and volunteers who work very hard to ensure that we keep this thing together, that we keep focused, Mr. Speaker. And I wish to thank the administrative staff, my own secretary, Ms. Florius, and all those who do the work to ensure that we keep the wheels turning. Mr. Speaker, I want to say to you that the strength on which I stand is from the people of V4 North. For them, I must and we must do what we have to do and do it well, because, Mr. Speaker, when it comes to health care and elderly affairs, every single one of us matter. And the people of my constituency, I wish to say to you that we will put our best foot forward. Mr. Speaker, it puzzles me, and I've said so before, that year in, year out, government comes in, government goes out, and we are unable, it seems, to solve the basic problems of an efficient healthcare system. It's puzzling, Mr. Speaker, because there are several initiatives, some of them costing millions and millions of dollars over the years, Mr. Speaker. And if you have to add up all of the figures, whether it be recurrent or capital, you'd notice, Mr. Speaker, that somehow, for some reason, efficient healthcare and the healthcare system of St. Lucia seem always to come up short. Pour qui ça, Mr. Speaker, l'année après l'année, toute qualité projet qu'a fait à cette ici, gros projet qui a coûté millions de dollars, et qu'il y a chaque année, nous avons parlé about healthcare, universal healthcare, avec assez pas qu'à fait, Mr. Speaker. Why is this? I put it to you, Mr. Speaker, that we must find a way. We must find a way to prevent unruly and vindictive governments from changing plans midstream when they get into office. Mr. Speaker, since 1997, when the St. Lucia Labour Party government came into office, the focus on universal health care came into it became a sharp priority. If you look at the strategic plan coming out of the consultations of the year 2000, Mr. Speaker, you would note that the St. Lucia Labour Party government focused on the deliverables, which some of them, the new general hospital, universal health care, a strategic plan for health, and all of these documents are there. But somehow, Mr. Speaker, when the United Workers' Party came into office, they simply dismantled the structures and our people continued to suffer. Why is it important for us to focus on health care, Mr. Speaker? More and more, Mr. Speaker, health care is being seen as a pillar of the economy. No longer would people think of health care simply as a social service. Pli, moun ki ka fè étude à la terre ka wè, zafè santé c'est un zafè qui est important à l'économie, Mr. Speaker. It is not just people who are sick and doctors with medication and so on and so forth. Let me tell you, Mr. Speaker, why all of us must get our hands and our energies into the healthcare enterprise in St. Lucia. Let me lay bare our situation, if you did not know, Mr. Speaker. The population pyramid for St. Lucia 2021 displays a progressively narrowing base over the past 2 decades, revealing signs of declining birth rates and an aging population. Pli en pli, Mr. Speaker, population cette lisi ka mouture, la ni plus grand moun en population, passé la ni jeune moun, laissé l'année à ka aller. Enfin, Mr. Speaker, conseil l'année à ka aller, nous ka wè, moins moun ka fait en cette lisi, passé avant. And this is very, very critical. If we have to look at studies, Mr. Speaker, the recently concluded situational and response analysis, which was conducted by the Ministry of Health in 2020, suggests that the population, when you look at the population, Mr. Speaker, in 2020, an estimated 10% of the population is considered to be 65 years and older. That is 18,906 people, Mr. Speaker. And if you look at the comparisons, in 1991, Mr. Speaker, 8.8% of the population was considered to be 65 years and older. In 2001, 10%. In 2010, 12%. In 2017, 9.5%. And in 2020, 10%. What does that mean, Mr. Speaker? Overall life expectancy in 27 was 75.9 years, with women living slightly longer than men, 82.1 years, and 70 years for men. So, Mr. Speaker, this is very critical for our country. And any government, if you are going to develop your economic policies, si nous pouvons faire plan by pays, ou nous pouvons garder population et garder qui manière population ka aller. And that is where you begin to see whether you're going to have challenges in the future, in the next 20 years, 30 years, and how you develop your plans in order to cope with these challenges. Why is this important? It is important because the St. Lucia Labour Party, having studied all of this, decided that we need to focus on elderly affairs as part of our priorities, Mr. Speaker. The Prime Minister decided that elderly affairs will become essential as we move forward. And when we came in, Mr. Speaker, we looked at the work which was done before. There is a national policy for older persons, a draft, in 2003. It was revised again in 2013. This policy, Mr. Speaker, highlighted several challenges with the elderly. But what has happened since then? Again, Mr. Speaker, it speaks to, over the years, we are not focused on what is critical for our people in relation to elder care, and therefore, when another government comes, the process slows down or halts. Mr. Speaker, currently, here is what we are doing. The government of St. Lucia seeks to review and update the national policy for older persons. We are currently carrying out consultations, and thanks to Dr. Zeister Edmond, who is leading these consultations, and the national dialogue has started, and I wish to thank the Prime Minister for his focus. We speak about what needs to be done, and I'm going to tell you at every instance what is happening currently, Mr. Speaker. So as we speak, Mr. Speaker, there are consultations taking place right now to ensure that we have a national policy for older persons which will go to the Cabinet of Ministers and then laid in the Parliament of St. Lucia, Mr. Speaker. It will take a 10 to 12 week period. Ça veut dire, Mr. Speaker, nous disons nous avons une campagne qui nous concerne les affaires grand monde. Avec nous pas avec 10 ans en bouche nous, là nous avons tué un gouvernement, Premier ministre là il mettait moi là il prend responsabilité pour santé avec les affaires grand monde. Il dit nous ni pour faire un policy pour grand monde. Avec à présent nous avons commencé à travailler là avec Dr. Zeister Edmond qui travaille tout au niveau pays cette ici, qui a parlé avec nous pour assurer qui nous fait policy cela. So very soon, Mr. Speaker, it will be coming to Parliament. We want to ensure, Mr. Speaker, that our policy promotes healthy lifestyles. It promotes an attitude of healthy aging. It promotes the capacity for caring for older persons and to ensure the quality of care at homes for older persons. Mr. Speaker, Prime Minister spoke to the programs for elder care, and we are hoping through the ministry with responsibility for equity, Mr. Speaker, that we will see some improvements. I have been to all but one of the elder care homes in St. Lucia, Mr. Speaker, and every single one of them, you see the commitment of the staff, the churches, and the volunteers who take care of our elderly. And I wish to congratulate them, Mr. Speaker. The staff of the Comfort Base Senior Citizens Home and the work which they are doing down there, I wish to thank them. Mr. Speaker, I want to tell you about actions, because after we visited the St. Lucy's home and the Johnson's home and so on, one of their main concerns is with food security, Mr. Speaker. And the nuns and so on, they were explaining to me that they can't get the elder folk involved in gardening if some assistance will be provided. You know, Mr. Speaker, you know, c'est gros problème là, c'est manger. À ce cas-là, que c'est gros moun kawete. Parce que manger cher avec, si on s'est planté manger à eux-mêmes, c'est pas tous ces gros moun qui sont allés en jardin, mais à dans ces gros moun veulent planter manger. Some of them have really done a lot of work, Mr. Speaker. And what did we do? Immediately, Mr. Speaker, I went, we got working, and my secretary, very efficient, we contacted the Taiwanese embassy and the Ministry of Agriculture, the minister with responsibility for agriculture. And I can tell you, Mr. Speaker, c'est pas blague Mercado. If you visit most of these elder homes right now, you will see, Mr. Speaker, that the Ministry for Agriculture has combined with the Ministry of Health and with support from the embassy, with the Taiwanese embassy, they have included the elder care homes in the HOOPS program, and right now there are green... I'm so happy, Mr. Speaker. If you go to these homes, Mr. Speaker, after our visit, you will see most of the elder care homes are now engaged in kitchen gardens with the assistance of the ministry. Thank you very much, Minister. Very therapeutic. Ek nou pa pa fè pièce go watch on la télévision. I wish to thank the Prime Minister because he spoke to me about the St. Lucy's Home. I will not tell you what he does for the St. Lucy's Home. He doesn't want people to know. But, Mr. Speaker, when I went to the St. Lucy's Home, the raving reviews about the Prime Minister, and immediately they said to me, Minister, you can help us with food. Contact the Ministry of Agriculture. And right now, let me thank the staff of the Ministry of Agriculture. They are now continuing to install kitchen garden shed facilities in the kitchen gardens. And very soon we will have a ceremony with the Taiwanese government there, Mr. Speaker. Mr. Speaker, the Prime Minister spoke of empowering our people and transforming our economy. We must radically improve the positive outcomes in healthcare for all St. Lucians. When we do this, Mr. Speaker, we will transform our economy. The Prime Minister said in his speech, we will ensure every St. Lucian has access to affordable and good quality health care. Mr. Speaker, we spoke about universal health care. And just this morning, I attended a ceremony where, Mr. Speaker, the management of the respiratory hospital, Ms. Nancy Francis, Dr. Alicia Eugene Ford, and the men at the respiratory hospital, they are now at Obel Seraphine. And you know what's happening there with Dr. Daniel and Professor Gray? They're having a wonderful workshop on men's health and men's issues, Mr. Speaker. I wish to congratulate them for their work. As we speak, this is going on. And I say so because, Mr. Speaker, in my conversations with one of the doctors, I remarked in my speech that every single year we hear about universal health care. Universal health care. From 2000, from the year 2000, the plans are there. I have so many reports, Mr. Speaker. There are reports from Dr. King, 2017, about the financing, the essential package of services. There are reports way back from Dr. Richie Haynes, 2005. There are reports from ministers of health from way back when, Mr. Speaker. But for some reason, we have not, as a country and as a government, been able to say, no, healthcare is important, and come high or low water, we are going to implement it. For some reason, Mr. Speaker, there is always a reason for us not implementing universal healthcare. Oh, it's too expensive. Oh, the economy is not good enough. And oh, we will not be able to collect the taxes. But we collect taxes, we implement all kinds of things. We want to spend $600 million on an airport. We take millions to bring horses down. All kinds of things. We pay for vaccines, for all kinds of things, and we're waiting to get our complete $7 billion. All kinds of things we get money for. But for some reason, we can't seem to even begin the implementation and the continuation of universal health care. When the Labour Party was in government, Mr. Speaker, we started incrementally with diabetes and hypertension, medication being given with no cost out of pocket. The UWP came in and things were changed. Mr. Speaker, we cannot continue as a country to place health care on the back burner anymore. We are not going to accept the excuses of we don't have money, we don't know where to find it, we don't know which tax to use, but we can find money for everything else. Mr. Speaker, the Prime Minister has charged me and he has said to me, we are going to get you the money, but get organized and organize the universal health care. We are going to get the money. And so, Mr. Speaker, no more excuses. Another doctor told me this morning, what are you all doing with St. Jude? So when I explained to him, he said to me, Musa, you know something? I like you a lot. But if you don't implement, if St. Jude is not finished, I'll be at the forefront to mobilize to vote you all out. Now that is the attitude of St. Lucians. This is the attitude of St. Lucians. And it's a positive attitude. I'm a politician, I always want to win elections. But no longer, although I've always won so far. And I'll definitely win again. While all others go to London. We are going to London, we have work to do. But Mr. Speaker, what we are saying is, he gone. Mr. Speaker, what we are saying there is, gouvernement après gouvernement, les bâteurs gouvernement, nous commençons à bailler moun qui diabetes, hypertension, anti soulagement, qui a commencé universal healthcare. Mais ça, quand tu as cassé, moi, comme ministre santé, c'est, là, je regarde un ministre là, avec moi, je permanent secrétaire pour moi, tout rapport, M. Calix, Dwight Calix, je pour voir tout rapport, permanent secretary, Miss Jenny Daniel, tout rapport. And when I look at the reports, Mr. Speaker, it's heartbreaking. We spent thousands and thousands, maybe hundreds of thousands of dollars in consultancies. We have experts in St. Lucia, expert doctors, expert psychologists, some of the best in the world. If you go to Tapio and Victoria and the hospitals, and you look at the citations of our doctors and our nurses are going all over the world. We have the expertise. It's not for want of better expertise, but we have not had a continuous political will, continuous. We have not had a continuous political will to implement universal health care. I want to say to you, Mr. Speaker, that whatever time God gives me in the politics, and as long as the Prime Minister wishes, I will be steadfast and we will implement universal health care. I guarantee you that. God willing. Mr. Speaker, what are we going to do? First of all, we must admit that universal health coverage is not a one-time show. It cannot be. All the research suggests that countries which are much more developed than us, South Korea, and I read the reports of so many countries, they started 20 years ago. Some countries started in 1971, and up to now, they have not concluded or come to a point where they can say they have achieved complete universal health coverage. So we are not trying to fool people and say, oh, everybody will get free medication for everything. Because universal health coverage is much more than just medication. So we are going to tell the people of St. Lucia exactly what we will do, the steps that we will take. And so the people of St. Lucia can evaluate, they can judge. After year 1, what should happen? And if it didn't happen, come back to tell us. After year 2, what should happen? I'm going to say to you, Mr. Speaker, that the difficulties which we have to modernize St. Lucia's healthcare sector include healthcare financing. Governments over the years have not provided enough money to the healthcare sector in St. Lucia. And if you look at the percentage of money we spend in our budget on healthcare compared to other Caribbean countries, we are one of the lowest. One of the lowest. There are others, but we are one of the lowest. So we must increase the amount of money we spend on healthcare. But I cannot go to the Minister for Finance and say, I want $300 million if I cannot provide the Minister for Finance with the rationale. Why do you want the $300 million and how are we going to spend it? Poor management of non-communicable diseases. Weak links between the budget health outcomes, making the quality and efficiency of public health outputs less than optimal. I spoke to a gentleman, I'll not mention his name because I don't know if I should. But I spoke to a well-known gentleman, a patriot, who lost his wife under tragic circumstances. And he was trying to get information out of the healthcare system. And when he came to my office, it really saddened me. He said to me, Mr. Minister, I'm going through pain. But the pain which I'm going through is not to say we don't have doctors or we don't have facilities. He said it's not the facilities. He said, yes, we have to reconstruct Central. That's important. But it's not just the facilities. It's that the system, the healthcare system, must show that it cares about people. The system. And therefore, we must focus on quality of outcomes. And that we are going to focus on. Mr. Speaker, we have gone to Cabinet, and the Cabinet of Ministers led by our Prime Minister has given his blessings to do the following. And I'm going to tell you exactly how we are going to begin universal health care. Exactly. The first thing we are going to do is we are going to use the performance-based financing pilot project as phase 1 of the implementation of UHC. This project is already within a World Bank project which we have. So as I go on, Mr. Speaker, you'll realize what I'm trying to explain. We are going to mobilize all of our functions within the healthcare sector, the Ministry of Health, our partners, to focus on universal health care. And so you realize we are not reinventing the wheel. You realize we are not breaking things down and trying to start all over again. What we are trying to do, Mr. Speaker, is to take the different parts of this vehicle, which we have found all over the place, and put it together and put a proper driver at the wheel to ensure we move UHC together and forward. So first, we are going to use the performance-based financing. We are going to proceed to encourage St. Lucians to register into the St. Lucia Health Information System service. That's the second thing. Third, we will work on the issuance of a health card. Fourth, we will add maternal and child health services, dialysis, and early cancer diagnosis to the first phase of the UHC initiative. Right now, we already have diabetes and hypertension. We will create a universal healthcare coverage unit to support the implementation of universal health care within the ministry. We have sought and received the approval of Cabinet for the creation of the Universal Health Coverage Special Fund. So, Mr. Speaker, I have told you exactly what we're going to do. So when I come here next year, or even before next year, I'm going to report to the people of St. Lucia on the success or challenges of what we're going to do. So I've told you exactly what the St. Lucia Labour Party government will do. So premièrement, nous avons servi un programme qui a dans World Bank, a gold loan, nous te pour World Bank là, nous avons créé performance-based financing. This means, Mr. Speaker, that when our clients visit our health and wellness centers or our primary care facilities and they seek assistance for diabetes or hypertension or maternal health and so on, we are going to ensure that they are part of the database, provide them with the services, and we are going to assess these services. We will know in 6 months' time, Mr. Speaker, we will know how this program works so that we can we can be in a better position to have a cost of essential health services. Because studies have been done before, but we need to update those studies. Mr. Speaker, nous avons regardé les affaires health card. Et nous avons mis les affaires madame qui go boudé, les affaires dialysis, les affaires cancer, et aussi nous voulons faire un unit en ministry, un petit groupe, Mr. Speaker, et travailler seulement sur universal health care. Avec le cabinet là, moi mené en consultation en cabinet là, avec le cabinet là, d'accord, nous allons faire un special fund pour universal healthcare coverage. So, Mr. Speaker, we are focused on bringing together all the resources of the ministry to ensure that we achieve this phased approach to universal healthcare. There have been a number of steps, Mr. Speaker. Over the last 5 years, the last government explored the idea of implementing a national health insurance. The last government wanted to have this health insurance through a private health insurance provider. They said they would cover the vulnerable population, and the rest of the population with the ability to pay would buy into the insurance package. Mr. Speaker, the COVID-19 pandemic highlighted some of the issues with this income-based system of health coverage. And there are many lessons all around the world. There are many lessons in the more developed countries, in the developing countries. And so, Mr. Speaker, we choose not to go in that direction. The economy as well as the fiscal position of the government these are still being impacted by COVID-19, and we believe that measured steps leading to the achievement of our goal is the best way to go. The phased implementation is the best way to go, Mr. Speaker. So US $4 million will be spent on this to begin the process, Mr. Speaker, and we are hoping that the lessons will help us. Now, some people will say to you, but diabetics and hypertensive people go to the health centers now and they get services and medication. But we are going to move one step further with the PBF and engage the private sector. So those people who need to take blood tests and so on in private labs, we are going to have contracts signed with the private labs, and we are going to use this as a model to ensure that we can cost the health system. Mr. Speaker, the Ministry of Health utilizes the health system, the SLUIS as it's called, to register patients. Of late, Mr. Speaker, we have had some updating of the system. Some data entry clerks were employed to clean up the system, to delete duplicate entries. A systems developer and a database manager were hired to support the PBF pilot, and they are doing some great work. As a result of this recent work, Mr. Speaker, approximately 60% of the estimated population in St. Lucia is deemed to have been registered in the system as of December 2021. It is now possible to determine the number of persons with diabetes and hypertension registered in each wellness center and the number of persons registered from the catchment population. In other words, Mr. Speaker, it does not make sense to simply implement universal health care and you do not have an efficient data management system which will give you information and which will help you. We have a serious problem which is developing in St. Lucia, Mr. Speaker. We realize over the past few years that there's been growing concern over the rise in infant mortality. And we are hoping to assist mothers. Currently, Mr. Speaker, pregnant mothers are able to get services at the wellness centers with no out-of-pocket payments. However, as I said before, lab investigations, ultrasounds, and so on must be done out of pocket. Ça veut dire, c'est maman, même si on allait à health center, et que vous êtes docteur, et que vous jouez un médio, si on y peut faire un ultrasound, ou bien si on peut faire un blood test qui sortit à de l'autre lab privé, on y peut payer l'argent. Ça nous qu'a faire, c'est madame là qui go boudé, les programmes là commencé, yo pas qu'à ni pour payer, même si on allait à de lab privé. We are taking the incremental steps. And as I said before, Mr. Speaker, we are creating a special unit for that. We note, Mr. Speaker, that there are about 2,000 young people in St. Lucia, females, who are being serviced at the maternal clinics every year. So we know the cost. It will cost us about $1,560,000 to include maternal and child health. Ça veut dire $1.5 million pour nous madame qui go boudé pour nous mettre un programme universal healthcare avec nous qui fait ça, Mr. Speaker. So, Mr. Speaker, we are doing incremental. We are moving in that direction. I will announce to you very soon, Mr. Speaker, our plans for our elderly folk who are on the side of Soleil Couché. We believe, Mr. Speaker, that having attained a certain age, when our people access our public services, they should not pay out of pocket. We believe so, Mr. Speaker. The work is being done, and as I said before, we will start incrementally. We believe, Mr. Speaker, and I know that the acting PS is doing a lot of work on this. She too is very excited about that. We believe, Mr. Speaker, that medical exemption cards or medical exemptions should be applied very soon or almost immediately to anyone who's 90 years and above. We are going to make an announcement very soon on the start date of this as we continue to consult and continue to get the information. And so, Mr. Speaker, while we have issues with our healthcare system in St. Lucia, there are so many opportunities. Cancer, for example, Mr. Speaker, the #1 killer in St. Lucia can be tackled. We can continue our awareness program. Look at what's happening with cancer awareness, the St. Lucia Cancer Society, Mr. Speaker. I had a brief discussion with Dr. Ramey, and also you can see what is happening with Faces of Cancer, which was formed in 2009, and Mrs. Dorothy Skid Phillip and her team. They are all around St. Lucia with the Ministry of Health and other partners and doctors and so on, continuing to educate our people in relation to cancer. Look at what has happened with men's awareness in St. Lucia. We have opportunities, Mr. Speaker, and I'm excited about these opportunities to cause our men in particular. As we know, prostate cancer is the #1 killer. While cancer is our #1 killer in St. Lucia, prostate cancer, Mr. Speaker, is the #1 killer. Because un homme, moi vle garder pour un saison côté un gouvernement qui tue concerné à les affaires prostate là, avec cancer à prostate là, avec te pas avec parler, nous kay mener attention pour les affaires cancer, avec nous kay fait ça. The Cancer Registry, and I wish to thank the doctors and nurses who are passionate about this cancer registry. Dr. Francois, Mr. Speaker, very passionate lady about the cancer registry, and we have started or continued consultations. I know for many years, there's been talk about the cancer registry, and there are benefits to the cancer registry. We must do it, Mr. Speaker. Again, as Minister, I continue to say that a number of these things were on documents from 2001, 1997, and so on, but there's not been enough focus. And this is what I bring to the table, Mr. Speaker. I bring focus and the passion to get it done, the commitment to get it done. So the cancer registry, Mr. Speaker, we are going to focus on it. I want to say there are opportunities, Mr. Speaker. Non-communicable diseases. While we must mention the percentage of people who die from diabetes and hypertension-related causes, I want to be a minister, Mr. Speaker, who speaks about the opportunities and what we are going to do. We are going to re-establish the National Commission on Chronic Non-Communicable Diseases, Mr. Speaker. We have gone to Parliament, to Cabinet a few weeks ago, and I want to thank Dr. Sear, who is working on this, and I've given her my commitment. The 2005 National Strategic Plan for Health, out of the 2005 National Strategic Plan for Health, non-communicable diseases were identified as one of the priorities, and work was done on it. In 2017, the Ministry, along with PAHO, established a multi-sectoral action plan, and that plan is there. What I'm going to do, as I said, Mr. Speaker, is to focus, laser focus, to achieve results. Why must we do this? Pourquoi ça pour nous garder les sécurité disease là, comme diabetes, high blood pressure, et comme ça? You know why, Mr. Speaker? In 2008, 71% of our deaths because of non-communicable diseases. Okay? High blood pressure, cancer, all these things. By 2014, it went to 81%. By 2016, 82%. Mr. Speaker, you know what it means? And we talk about the economy. And more people in healthcare are talking about the impact of healthcare on the economy. And you cannot speak about economic growth if you don't talk about healthcare. You cannot. And I'm going to ensure, Mr. Speaker, in my term, that healthcare is spoken of just like you speak about GDP and fiscal measures and so on. That is what's going to happen, Mr. Speaker. You know what? Let me tell you, Mr. Speaker. The research says that in the population, people aged 16 to 64, 16 years to 64 years, non-communicable diseases, cancer, diabetes, stroke, and so on, let me put it a very simple way. It took away 24.7 years of productive life from men in St. Lucia. So think about that, Mr. Speaker. Think about that. Men in St. Lucia who have diabetes or cancer and those kinds of things, 24 years of their life, of their working life, was taken away. They can't work, Mr. Speaker. Now, if you have that, how can you even talk about economic growth without a strong labor force? And men, and for ladies, they lost about 24 years of their productive life. Now, Mr. Speaker, so what could ça bien? Ça veut dire c'est raison nous ne pouvons pas parler les cancers, diabète, raison c'est bagay ça là important parce que nous pas ça ni pièce développement économique si nous pas parler des affaires santé. Ça étude là qu'a dit nous, c'est mon qui mort avec stroke avec diabetes, obésité ni pas moun qui mort, moun qui ni malade là. Puis ça dou avec bail comme ça, c'est nom là l'année 24 l'année ou ka perdre 24 l'année ou ka perdre qui ou passe à travail. Et c'est madame là l'année alors 23 ou 24 l'année ou ka perdre. Comme ça c'est important. Mr. Speaker, obesity, serious problem. So we are not here to talk about all of the statistics only. The doctors know it. The Department of Health, especially the education, public education section, they put out, whether it be education, videos all the time. We know that obesity is a big problem. In 2012, Mr. Speaker, a study showed that between the ages 25 to 64, 53.9% of men were overweight in St. Lucia, 77.1% of females. It must be higher now. And if you are overweight, Mr. Speaker, you are looking at problems, possibly cardiovascular disease, diabetes, and so on. How much are we losing to these in our economy? Mr. Speaker, I want to say to you that this government is focused. I want to tell you, Mr. Speaker, that the hospitals will also be in focus. And I have thanked the various boards of the hospitals. We have a new board at the Millennium Heights Medical Complex under the chairmanship of Mr. Michel and Deputy Chair Dr. Stanley Jean. And they are working, Mr. Speaker, to ensure that the hospital meets its objectives. I don't want to say too much at this stage, Mr. Speaker, because they are reviewing several processes. They are also reviewing the work of a consultant which was hired by the last government, and the Prime Minister said the amount of over $4 million, and much more will be said about that soon, Mr. Speaker. I'm not one to speak out of turn. I want all my facts and all my figures. I want to say to the staff and management of the Millennium Heights Medical Complex that we are working with you. We are going to ensure that the efficiencies come, and we are going to ensure that your budget matches what you need to do at the hospital. Mr. Speaker, St. Jude Hospital is a Quev chair, as a doctor told me this morning. Many doctors told me many things this morning, Mr. Speaker. St. Jude Hospital is a Quev chair. I want to tell you, Mr. Speaker, that many of my colleagues have spoken about St. Jude Hospital. The Prime Minister, the Minister in the Ministry of Finance, they have spoken about the St. Jude Hospital. And today I will not speak much about the St. Jude Hospital. I want to say to the staff, patients, and the board of the new board of the St. Jude Hospital that we are committed to ensuring your safety, and we are committed to ensuring progress at the hospital. Mr. Speaker, I must tell you that the reports which I have in my possession do not speak.
Member for Vivo North, you have 15 minutes left.
The reports do not speak well of the stewardship at the hospital in the past. There are several things which must be corrected, Mr. Speaker, and at the correct time, I will let you know what these are. But I want to thank the board, Mr. Elevic and Mr. Norman Edward, for their work, Chair and Vice Chair, and the rest of the board. And I want to thank Mistress Altifoy, and board members for their quick action when one of the canopies, the one at the eastern end of the hospital, started to give way. And quick action caused that canopy to be removed, and the other one will be removed. Mr. Speaker, the respiratory hospital, again, I want to pay tribute to Dr. Alicia Ford Eugene and Miss Nancy Francis and all the staff for their work during the heights of the COVID-19 pandemic, their sacrifices and all of what they had to endure. I have said to you before, Mr. Speaker, what we had to do to cause there to be better conditions at the respiratory hospital. The doctors made sacrifices. The porters made sacrifices. All the medical staff made sacrifices. And those doctors in the private sector who assisted at the Victoria or the respiratory hospital need to be commended. Mr. Speaker, I want to say to you, Mr. Speaker, that a comprehensive assessment is being made of all of our health and wellness centers. And the Larry Shoes Health Center, Mr. Speaker, which was spoken to by the parliamentary representative, will get assistance, Mr. Speaker, will get repaired. As we move on, Mr. Speaker, as a country trying to survive with COVID-19, we are going to ensure that 8 broad areas are looked at. We want to ensure that we continue to build a resilient health system, that the governance for health is strong, execute an effective vaccination campaign, continue to spread the message of slowing the spread through our public health standards and measures. We want to ensure that schools, businesses continue to operate safely. We want to ensure that we protect people at highest risk. We want to ensure that we increase public compliance with the protocols. We know, Mr. Speaker, that we must successfully coexist with COVID-19. It requires the whole of society, and it requires all of us to be united in this effort. I want, Mr. Speaker, to continue to thank all those who made sacrifices, all those who lost loved ones and continue to suffer. We continue to express condolences. As we've said before, every single one of us around this table may have lost a relative, a friend, to COVID-19. Every single one of us. So this has become a scar in our memories, in our lives, and we will work together to ensure that we move on from this. Mr. Speaker, we have a crisis in our pharmacy, in the area of pharmacy. There are many pharmacies, Mr. Speaker, which have to close temporarily because of the lack of pharmacists. I want to raise this as an issue which we will definitely tackle, Mr. Speaker. There are a number of reasons for this, and we will. Mr. Speaker, I wish to focus on what I call our health ecosystem, our partners. And I want to spend some time to say to you that apart from the doctors and the Ministry of Health and the hospitals and so on, there is a whole health ecosystem which requires governments to pay more attention to, and which requires us to cause them to be more integral partners in the healthcare development in St. Lucia. Help Age, for example, the National Council for and for older persons. People like Mrs. Gerald Bray from the St. Lucia Planned Parenthood Association, Mr. Speaker. The work which is being done by Mr. Anthony Avril of the St. Lucia Blind Welfare Association, operating clinics at low cost for St. Lucians. The St. Lucia Sickle Cell Association with Ms. Sophia Harry and her team. The Child Development Center, Dr. Kim Gardner Sadhu. They receive over 500 referrals per year, Mr. Speaker, with children 0 to 5 years with developmental delays or at risk. Faces of cancer. And you see the work of Mrs. Dorothy Phillip and the rest of her team all around St. Lucia. Medication, tests, and so on with their health fairs. And all of the doctors, Mr. Speaker, and nurses who sacrifice their weekends to ensure that we come together to assist. They have serious concerns about space for oncology at our hospitals, where cancer patients sometimes share waiting areas with other patients and so on, the need for radiation, issues with our own processes, where cancer drugs, Mr. Speaker, sometimes take an inordinate on a long time to get to St. Lucia. We have serious problems which we must keep focusing on, keep the focus on. We have spoken about nursing, Mr. Speaker, and this is a major problem and a major headache for the healthcare sector in St. Lucia. While it's a headache, Mr. Speaker, there are also opportunities. The nursing sector, Mr. Speaker, continues to suffer because so many countries know that our nurses are well trained, they are valuable, and, Mr. Speaker, people from all over, from England, from the United States of America, institutions are lowering our nurses, Mr. Speaker. We note that in St. Lucia, there are about 679 nurses in active service, 74% of them in the public sector. Mr. Speaker, we have an acute shortage of nurses. At OKEUH, we need another 95. At the St. Jude Hospital, Mr. Speaker, nous besoin 20, another 20-something nurses. In community nursing service, another 36. Respiratory hospital requires another 20-something nurses. How have we been able to deal with that? The government and people of Cuba, Mr. Speaker, once again come into focus, and they have been helping us and assisting us, and we should thank the government and people of Cuba. Where are our nurses going, Mr. Speaker, as I close? In the year 2019, we had a big blow. 109 nurses left. The United Kingdom, 55 of them left. The United States, 44. Bermuda, 7 Cayman Islands, and a few other countries. In 2020, 52, 2021, 63, and so far, Mr. Speaker, between January 2022 and April, 19 of them have left. And so, Mr. Speaker, do we throw our hands to the wind? What do we do? It costs an average of 40,000 EC dollars to train a nurse at the Sarfa Louis Community College. We have said, Mr. Speaker, and the Prime Minister has repeated that we will find a way so that our nurses are no longer on these 3-month contracts and 6-month contracts and 1-year contracts that they have to suffer with right now, Mr. Speaker. We will find a way, Mr. Speaker. Mr. Speaker, the Environmental Health Department is critical, and we are now reviewing our port health surveillance systems to ensure that environmental health comes back into focus, Mr. Speaker. I recall as a child the Environmental Health Division.
Member for Vivo North, you have 5 minutes left.
Thank you, Mr. Speaker. I recall as a child that the Environmental Health Division was critical. That was almost, it was almost the face, Mr. Speaker, of the ministry, the Department of Health. And we are going, Mr. Speaker, to cause the Environmental Health Department to come into focus as the vanguard, because without their assistance and expertise, Mr. Speaker, we are going to have problems with non-communicable diseases, all the connections to our issues, Mr. Speaker. The Environmental Health Department has to lead. So once again, Mr. Speaker, let it be written that on that day, April 26, 2022, the Member of Parliament for Castries East presented his first budget address to the people of St. Lucia and witnessed by the world. I congratulate our Prime Minister, Mr. Speaker, my friend, the first leader from the Castries Basin since Comrade Sir George F.L. Charles to lead his party to victory in a general election. And what an exemplary Prime Minister he has been so far, Mr. Speaker. Look at his actions and policies. It is clear for all to see that our Prime Minister is very, 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 very different to the last Prime Minister, Mr. Speaker. When you look at our fiscal, the state of the economy, Mr. Speaker, the last Prime Minister, GDP was declining from 2017 and a massive one in 2020. So when they talk about this growth is theirs, this growth is theirs, Mr. Speaker, I wish to once again commit my energies and my spirit and all of the love which has been given to me by the people of Beaufort North. I wish to commit all of that to this enterprise of a successful St. Lucia Labour Party government, Mr. Speaker. And as I said to you before, we must continue to account to the people of St. Lucia on the matter of health care. And I want to suggest to you, Mr. Speaker, and I know you know where I'm going with this, I want to suggest to you, Mr. Speaker, that the time has come for us to have a parliamentary committee on health care in this country, Mr. Speaker. The time has come. Because every time a government comes, some very good initiatives like universal health care, because a minister has his own idiosyncrasies, they change course and so on. The people have to hold these processes accountable. So if we have a committee, the people know they can come here, whether you are a businessman, a doctor, you can come here, there are questions to the minister, the government presents plans, and the whole country knows. So when the next government comes, even though I may not be the Minister for Health, when the next Labour Party government comes, and the Labour Party government continues, the next Minister for Health, or the next whoever it is, can account. And no one politician can decide to just shift gears like that. So I thank you, Mr. Speaker. I thank the people of Beaufort North, and I wish this government well. Thank you very much, Mr. Speaker.